on.
Now we're live?
I think we are.
I'm feeling a little goofy today. Hi, everybody. Kat Ludwig, dietitian. My lovely friend.
And I am Stephanie Pepper, and I am a speech-language pathologist.
Yes.
And I hit the refresh, yeah.
We're just working on making sure we're up and running for this evening.
There we are.
There we go. I got the right button. Okay.
Yes, you did.
Welcome back, everybody.
Yeah.
We're talking about reflux today.
We are. Let's wait a little bit. There's nobody there yet, so
Okay.
we're going to wait till they
enjoy our tea.
enjoy our tea. We will be talking about our tea shortly.
Tea is really helpful for reflux in certain situations. Yeah.
I can't wait to hear more.
I know. I can't wait to drink more tea.
This is good.
And the honey was helpful. I like it.
A little soothing.
Mm-hmm. Plus, it's cold here, and I was in Tucson for like 4 days, and it was super warm. And
Yeah, I know. Not cool. You don't need to bring that up now.
You're coming with me next year.
It was
We're not going
snowing.
to Tucson, but anyway. All right, everybody. Welcome to Cooking with Kat and Steph. Even though we're not really cooking tonight.
We're not cooking,
But we're going to talk about some food things. We're going to talk about reflux. We're going to talk about some strategies and some home remedies that you can use to address reflux.
and we'll talk about triggers.
Mm-hmm. Yep. So I guess I'm just going to get started talking about what GERD is.
Let's do it. Let's talk.
Gastroesophageal reflux disorder happens when acid from the stomach moves up the esophagus. Not supposed to be there, right?
Right. So the membranes of the esophagus are different than that of the stomach.
Mm-hmm. They're very similar to your skin
cells.
Yep. So we want to protect the membranes of the esophagus because your skin's not supposed to have acid on it either. It's very painful.
Right. Technically, it can burn
Yeah.
you. It will burn you.
Yes. So if left untreated, it can cause permanent damage to the esophagus, to the pharynx, and
It can go as high as the nasal cavity
Yes.
and sinuses.
and we have seen it.
We have.
Yeah. So it can be acute, which means it can be short-term, or it can be chronic, long-term. A lot of the people that we see, long-term.
Long-term and chronic. And some of them didn't even realize that they had reflux because there is this crazy thing called silent reflux. And who
Right.
would think that you wouldn't be able to feel it? But I think your body just accommodates and gets used to that sensation.
Yeah, absolutely. So I want to cover just basic anatomy. So the esophagus is a tube that runs from your oral cavity and your pharynx down into your stomach. Mm-hmm. And all it is a passageway. It does have motility, which means there are little muscles that push things down into your stomach. And we want to keep those functioning properly.
Yes.
Because if that doesn't function properly, then we see problems. Yes. Okay. So the esophagus has two muscles that keep it open or closed.
It can open, but it tries to stay closed.
Yes. So I wanted to cover that before I get any further into the anatomy piece, because one of the things that we know is that when you have low acid in your stomach, that sphincter doesn't want to stay closed. So a lot of people have reflux when they have low stomach acid because then that sphincter doesn't stay closed.
Right. So the esophagus is going to protect itself from acid.
Hi, Amber and family. Welcome.
Hi. So the esophagus wants to stay closed to protect, but if it doesn't feel that there's a danger, it will relax. That lower sphincter will relax. So if you have even a little bit, it will reflux up. It will come up, especially if it happens at night, you're laying down and it doesn't have to go against gravity.
Right.
That's when it can go up really high to the pharyngeal level and or nasal and sinuses.
Yep. So 2 recommendations for that. Don't lay down after you eat at least wait half an hour, but I would say wait 2 hours minimum before you lay down.
If you're a known person with reflux, then 2 hours is a great idea.
And if you can't, lay on your left side when you lay down, because your stomach has a bulb here. Of course, this is for anyone who has not had their anatomy changed. So your stomach is sort of flat on this side and it's got more of a bulb on this side. So if you're laying on your left side, typically the gravity will hold it down into that bulb without it going up as likely. It's not as likely for it to travel back up.
Right. It keeps it farther away from the lower esophageal sphincter so that it can't.
Yep. I just have my notes here to make sure I'm okay. So symptoms of reflux include pain. That's my first symptom.
Right. So some people call it heartburn.
Heartburn. Yep. Increased belching.
We see that.
We do see that a lot. Difficulty swallowing. We see that all the time.
That's everybody.
A lot. Yeah. Esophageal spasms.
Which can be painful.
That's what I hear. And we're hearing more and more about people having esophageal spasms.
Right.
It's very likely that it's related to reflux. Inflammation of the lining of the esophagus. I would also just contribute this back to heartburn.
Right. So as the acid is traveling up and down the esophagus.
Hi, Kara.
Hi, Kara. As it's traveling up and down the esophagus, that acid is essentially burning those mucous membranes. Yep. And so say you burn your skin, it's going to become inflamed because it's trying to protect.
Yep.
So for a lot of people, if they have this constant inflammation in their esophagus, then it makes the esophagus narrower.
Right.
And therefore things tend to maybe get stuck or at least feel like they get stuck because there's an imprint of that food.
Right. So I like to contribute it to, we like inflammation. Inflammation is a good thing. Inflammation is how your body heals you and protects you. So we need inflammation to happen. However, if this is a chronic situation and it's inflamed all the time, this is what you're referring to.
That's correct. So this is chronic inflammation. If it stays inflamed, that's when it's not doing you.
Right.
It's doing you some good because it's protecting from more damage. However, it's also preventing you from eating well.
And then we see malnutrition, which contributes to worsening symptoms, which contributes to more weakness.
Right.
And more problems.
Right.
So our goal is to get it under control before we get to that point. But sometimes we don't have that option.
Right.
So then we start with where we're at. Hoarseness. Can you tell me a little more about that?
Yeah, let's talk about hoarseness, because if you get hoarseness from acid reflux, that concerns me, because that is your vocal cords are in an entirely different tube.
I brought George.
Yeah, that's a great idea.
So the trachea is the one in front.
And so your vocal cords are in the front tube, which is your trachea and larynx.
Yep. So the esophagus is this really thin one back here.
The posterior or back tube, which is connected to your stomach. So that's where the reflux would come up.
So if the acid comes up here and gets right up here.
Right. Gets right up here, it might be painful. But if you're hoarse, my guess is some got onto your vocal cords, which means it penetrated into the wrong tube.
Right.
Like it was on the verge of aspiration.
Right. And it just burned a little bit right there.
It burned,
which caused this symptom.
Which changes the vibration of the vocal cords, and that's why you're hoarse. That's why people are hoarse when they're sick.
Yep.
Because
So acidic taste goes along with this one, because if that acid gets up into your mouth, you can taste it.
Yep.
Dry cough. This goes back to being in the wrong space. It shouldn't be there. It's causing another symptom.
Right. Wrong tube. Shouldn't be there.
Bloating.
Ooh.
This is one we don't talk about.
No, we don't.
Very often.
But we hear that. We hear that a lot, actually.
Yeah, we hear. So I'm gonna come back to that one in a second.
Okay.
I'm gonna cover the last two first. So food feeling stuck. We hear this one all the time.
Yep.
Food's stuck in my esophagus.
And for the exact reason that we were just talking about, because as your esophagus inflames, because it's trying to protect you, it's not leaving enough space for food to go through or go through easily. So, so things can get stuck. But many of you have had video swallows or modified barium swallows, and it shows that food does not get stuck. I typically attribute that to something that I call an imprint sensation. So your esophagus can be, if you imagine it like a memory foam mattress. Do you know how you put your hand into a memory foam mattress and you take your hand off and it leaves the imprint, at least for a little bit? That's what food does as it goes down. It's leaving an imprint. And so the esophagus has a change of size for a short period.
Yep.
And that's often what people are feeling.
Yep. And so I think this comes back to the fact that your esophagus has a lot of nerves in it.
They do. It does.
And those nerves send signals to your brain. And this is where the pain, the sensation of things feeling stuck comes from. And when you have that inflammatory process going on and you have some damage, even if it's just minimal damage, you're hypersensitive, which goes back to what we talked about 2 weeks ago with those sensory experiences. So it all plays a role.
It all plays a role. And then you start thinking about it more. The more you think about it, the more you feel it. The more anxious you get about it or concerned.
Yep. And then our last symptom that I have written here is regurgitation. So this is slightly different
than reflux.
From reflux.
So regurgitation is simply that food goes down, but not all the way to the stomach.
Right.
And then comes back up.
Right.
Before it goes to the stomach. And part of that reason can be the inflammation, that it's just not making it there. Because there's a smaller space.
Right.
So it needs to move out of the way so that, you know, things can go through in time.
Okay. So let's talk about bloating.
Okay.
Because this ties directly into food triggers.
Yeah. Oh, good. Yes. Let's talk about triggers.
So your triggers for reflux are your own. Everyone is different. I have different reflux triggers than Stephanie. I get reflux if I'm not careful. I don't know that you do quite the way
maybe 2 or 3 times a year,
right?
Depending on what I'm eating and what's going on in my life,
right?
But I don't typically have much reflux.
So I do, and I think there's a genetic piece there that I can't prove, but I have to be very, very careful about what I eat and how much.
Okay.
So the how much piece is just eat less, because when your stomach is that full, sometimes it's got to go somewhere.
Yep.
And if it's not ready to digest and go down, it comes back up. So eat less, number 1. Number 2, identify those triggers. Are you triggered by acidic things like tomato sauce, coffee? Sorry, I haven't had a whole lot of sleep. My brain's a little fuzzy.
So spicy things. Tomatoes. Tomato sauce.
Some people are triggered by nightshades, which are like eggplant, bell peppers, tomato, potato.
Citrus, certain fruits.
Citrus triggers people pretty significantly. Orange juice, for me.
Okay.
I can eat grapefruit all day long till the cows come home.
Interesting.
Can't do orange juice.
Huh.
So everybody is very, very different. So with bloating, what that tells me is that you're putting something into your body that your body is struggling to digest.
Okay.
If you're not digesting it, sometimes it can create gas in inopportune places.
Okay.
So we have to figure out what is causing the trigger to your total immune system, because it could be that it's a type of carbohydrate that you're just not digesting. It could be that it's a leafy green that your body doesn't like. It could be a fruit. Literally the possibilities are endless because everyone is different. So it's a matter of figuring out what the triggers are. And I usually recommend keeping a food log and writing down what the symptom is and when you had it. Because then we can start to see patterns.
Right. I wonder if we could, we have a paper food log. So if anyone out there would like a copy of a food log, put food log in the comments, and then we'll email or we'll message you and
Send it over.
Somehow. We'll need your email address.
For our clients, we have them keep a food log on an app.
Right.
But if it's just for your information, we can send that.
We can send a paper log that you can keep track of that has a space that you can write your symptoms.
Okay, so let's talk about just some contributing factors that can just increase your risk of reflux or can make it worse. So smoking.
Okay.
Is a huge one for reflux. We really try to get people to stop smoking for a lot of reasons, but especially if you have reflux, it's making it worse. Use of muscle relaxants because it releases that sphincter. And then also NSAIDs like ibuprofen and naproxen sodium because they can damage the lining of your stomach.
Okay, and honestly, I had more reflux pain when I had something with my foot. I had surgery on my foot, and I was taking meds. And that's when I had more issues.
Yeah, that makes sense to me.
Yeah.
Your body did not like those meds.
No, I didn't either, but it took the pain away. At the time.
And so anytime it's a situation like that, we want to keep the med intake to a minimum, especially if it's going to be short term. Being overweight can sometimes contribute. So we work on weight management for some people, not for everyone. Everyone is different. Reclining or bending over. I had a morning where I hadn't eaten anything, hadn't even drank water yet. I went to do yoga and I went to do downward dog. I had heartburn the rest of the day, like without warning. So sometimes it happens. Restrictive clothing. So women who wear really tight clothing, they used to be called corsets. What do we call them? Spanx. Like anytime you're trying to hold it in, if your belt is too tight, even though that's a little lower on your waist,
that's still causing the pressure. It's upward.
It's still causing the pressure. So a lot of times we'll say, loosen your clothing. Wear looser clothing. Use of progesterone-containing oral contraceptives. So birth control.
Can cause reflux.
It can mess with your hormones.
Yeah, it makes sense.
Right?
That makes total sense.
And so we see a lot of people with hormone changes, especially in pregnancy.
Gotcha. Yep.
That end up with worsening heartburn.
Okay.
So that's my next one. But also, when you're on birth control, it messes with your hormones. When you're pregnant, your body's hormones are doing some out there things. Both of those different situations contribute.
That is true.
To risk of heartburn.
Okay.
Anyone who vomits frequently, super high risk, because we're forcing that open, and that can weaken that lower esophageal sphincter.
Sure.
And then, like I said, eating too much, drinking alcohol, eating your triggers, eating late at night, mint, for me is a big one. Like I used to love mint tea and then I realized it was causing that loosening because it's a relaxant.
Gotcha. Yeah.
Eating too much fat. So like fried food. Oh, I avoid fried food for that reason because I just end up terrible afterwards. Connective tissue disorders.
Okay.
So this would be like anyone who has trouble with, the one I'm thinking of is Ehlers-Danlos syndrome, where some of those tissues are weakened or too relaxed. So I want to talk about meds because we have some...
Right. Some immediate help if you're feeling it.
Yep.
Tums is an immediate. There's Rolaids. There's other Gaviscon, I think. Do they have Gaviscon?
Gaviscon is, I don't know that we can get it in the US. I know a lot of our clients in the UK use it. I think you can buy it on Amazon.
Okay.
But I
know that's what my grandmother used to take.
Yeah.
So I remember those from when I was a kid.
Maybe you
up in
can
her.
find it now. I'll have to look. Pepto is another one that I recommend. I don't like to use it super often, but for anyone, it is pretty thick. So if you have trouble with thicker liquids, we say cut it with some water.
Right.
Alkaline. Ooh. She's an essential oil.
Oh,
yeah,
that's true.
After my own heart. Yes.
And just so everybody knows too, the Tums smoothies will melt into your tongue quicker and easier than the regular chalky ones.
Yep. That kind of get stuck.
That may get stuck and don't melt very easily.
Yeah.
So the Tums smoothies, or if you need liquid, there are other kind of liquid antacids as well.
And so we also have famotidine, which is an acid reducer. So this one works as it works on your acid production in your stomach. So I don't like long-term use of these. So this would be like a proton pump inhibitor or a PPI. A lot of people are on omeprazole and pantoprazole and lansoprazole. They're all sort of in that category. So they tell your stomach to stop producing acid.
Which is great if you're a high acid producer.
Correct.
But if you're not a high acid producer and you limit the amount of acid that you're producing, and we'll talk about that, you're creating a bigger problem.
Yes.
Than you're helping.
So from a nutrition standpoint, we need stomach acid to digest protein. So for anyone that's working on getting protein in, we need you to have acid in your stomach because you can't digest the protein if you don't have the acid.
Right.
Now, if you're not eating a ton of protein and then you increase your protein all of a sudden, we might see symptoms because your body has to re-regulate.
Right.
And that's okay, but we want to do it in a very controlled way.
Slowly.
Because we want you to have protein. You need to have protein so that you can heal because protein helps with healing. It helps with your immune system. It helps with muscle strength, which we need for swallowing.
Yep.
Plus everything else that we do in our daily lives, walking, talking, moving, etc. You get
everything you do requires muscles.
So we want you to put protein in your stomach because we need that pressure from the food in your stomach to keep that lower esophageal sphincter closed.
True.
I find that most people don't eat enough protein. And this is everybody. This is not just our people with dysphagia.
Right.
How often have I said this?
Well, I know that I don't. I put protein in my coffee every morning because I don't eat enough protein. And I just don't eat enough.
So we work on getting enough protein in because a lot of the time that can help correct what's going on in the stomach. Now, I had asked my doctor because I was having really bad heartburn in the late summer. And she was like, do you really want to take a PPI? And I said, no, I don't. She goes, okay, so let's talk about food instead. And I was like, well, that's my jam, dietitian. So, but one of the things that she had told me was, I don't like to do long-term use of PPIs with my patients. And I said, okay, what do you do? She goes, I have them do 6 weeks on and 10 weeks off because we don't want your body to become dependent on the medication. And so I really, really liked her talking about it in a more holistic way.
Right. I know so omeprazole is typically sold in 14-day doses. So they only recommend 2 weeks on it.
Right. Right. And they do that very specifically when you buy it over the counter.
Right. Because if you stay on it, and again, your doctor may be different, and that's fine.
Right. Some people end up having surgery.
Right.
And there are multiple different procedures, and some are appropriate for some people and others are not. So that's something you have to talk to your doctor about. I had a nurse at one of the hospitals I work at that had a procedure called a Lynx procedure, where they put these beads around your esophagus. And so they're magnetic. And so you have to basically retrain your body to push things down. So you have to have a manometry test before it to make sure you have good pressure.
Sure.
And her reflux was really, really strange because she could drink water and she would get, like, she could totally starve herself and she would still have heartburn. It did not matter. Her trigger was literally everything. So for her, this Lynx procedure was appropriate.
So her lower esophageal sphincter probably just stayed open.
Correct.
So it didn't matter what.
Correct. And so for her, it wasn't necessarily about the food she was eating. It was just an anatomical problem.
Right.
So that was appropriate for her. It's not appropriate for everyone. We always try to do nutrition first because sometimes that can be hard to figure out.
Gotcha.
Okay, so I want to talk a little bit about food. So we're having tea. So this tea is chai. So it's black tea and it's got cinnamon, cardamom, clove, and ginger in it.
And it's delicious.
It's delicious. The other one we have here is a cinnamon tea. Let's see if I can put these up a little. You still can't see them.
Well, chai and cinnamon.
Okay. Chai and cinnamon. So cinnamon tea for a lot of people can be helpful at calming the stomach.
Interesting.
And so I like trying things like this first because you never know if it's going to work.
Right.
And if it does work, then maybe you don't need
meds.
If that doesn't work, try adding higher probiotic foods to your diet. Kefir, yogurt, cultured cottage cheese, like the good cultured cottage cheese is one of my new favorites. Miso, tempeh. I haven't blended tempeh. It's one, I'm not going to lie, it makes me a little bit nervous because I don't eat it anyway, so I don't exactly know how to cook it. So I'll have to...
We'll get back with you on that.
Get back to that one, yeah. Kombucha. We're both kombucha.
Yeah, well, when I do get reflux, I do ginger kombucha.
Makes sense because the ginger is really helpful for the stomach as well. And then herbs, turmeric, ginger, fennel, cinnamon, cumin, coriander. Most herbs and spices can be very, very beneficial for decreasing inflammation. And that's what it's all about.
Cool.
So we like whole foods that have spices and herbs in them all the time.
Yeah.
Marshmallow root is an herb. You probably haven't heard of it before.
I have not.
It's not super common.
Is it something I can plant?
Yes.
Will it grow up here?
I don't know. Now I'm going to have to find out. Let me get back to you on that. Marshmallow root, very, very helpful to make into tea and to drink that. Licorice. So there's a supplement out there called DGL, deglycerinated licorice, I think is how you pronounce it. The word is like this long.
Okay.
We just call it DGL. It can be very, very helpful, and you can crush the tablets.
Okay.
So
perfect.
You can powder them. Yeah. And then chamomile, also a tea, one of my favorites.
Nice.
So cinnamon tea, let me make sure I talked about sleeping on your left side or staying upright after a meal. Timing of meals. For some people, this is really, really important because your body is guided by circadian rhythm.
Yep.
Your digestive system is also guided by your circadian rhythm. It's not just about sleep. But I can tell you, when I was attempting to sleep last night and I could not fall asleep, I was hungry because I hadn't eaten. And so that it was a really awful end of my day. It started out great. Vegetable juice. Vegetables are anti-inflammatory. So sometimes vegetable juice can be helpful as well.
Okay.
I'm not talking like tomato juice either. There are some other options out there. If tomato is not a trigger for you, tomato juice might be fine. But for some people, it's not helpful. We didn't talk about this one. So increasing saliva production can help wash.
So that's why some people ask for a peppermint.
Yes. So I just tell people to be very careful with peppermints because of that relaxatory effect. I would say find a cinnamon mint.
Gotcha.
Instead. They're out there. Altoids make them. They're delightful.
They're strong.
They are strong.
Curiously strong.
Yes. Okay, so I think I covered all the rest of these. The very first two on this little list I have here, we didn't cover. So can we talk about your son for a second?
Yeah.
Will he let us?
Yeah.
Okay, so he was having some pretty severe reflux at one point.
Yes.
What did he do?
He started taking apple cider vinegar.
Yeah.
A sip of apple cider vinegar every morning.
Yeah. So he was a low acid producer and needed more acid in his stomach.
And I'm willing to bet it's because he didn't eat enough protein. But the apple cider vinegar helped because it added the acid that his stomach needed for his sphincter to stay closed.
Yes. Amazing.
It worked.
Okay, so now let's talk about people that have the opposite. After we, Megan found a ginger mint and Trader Joe's. Ooh, very interesting. Can you send us a picture of them over Instagram or Facebook or whatever to our messaging? Because I'm curious. I want to get some and try them as well. I bet they would be very helpful.
I think that's
awesome. I like ginger mints as well. That's a great idea. Okay, so the last one I have is for those of you that are overproducers of acid. What do we do? And this is where my husband comes in. So I don't have his permission to share this, but I'm going to. So please forgive me, darling, if you're watching. He is a bicarbonate fan. So he goes and gets a cup of water and puts some baking soda in it, stirs it up and drinks it down. And then he has a nice burp and his heartburn goes away because he's an overproducer.
So he just neutralizes it.
Just neutralizes it. Yep.
Cool.
Yeah. So we like natural remedies if possible. For some of you, that's not possible. So identifying those food triggers and potentially lifestyle triggers also, very, very helpful. We hear recently, we've heard a lot about pregnancy causing dysphagia. And for the majority of them, I'm willing to bet it has something to do with your hormones.
All about the hormones.
And heartburn sort of happening at the same time.
True.
Because a lot of times that heartburn happens because of the hormone changes.
Right. And reflux is happening because of the hormone changes.
Right. So
it's just that cycle.
So we have to get your diet figured out. We have to get your intake figured out so we know what your triggers are so we can get that inflammation down. All right.
Cool.
I think we covered a lot of things here. If anyone has any questions, you already sent it. Thanks, Megan. Fantastic.
Thanks.
Questions about reflux.
Yeah.
The great thing about tea, if you need a thicker liquid, is it can be thickened as well.
It can.
And you can thicken hot liquids.
You can.
Or cold liquids.
Yes, you can. Purithic and Dysphagia Aid both thicken cold and warm very well.
And we had a question from someone else in our universe about thickening, someone that's a caregiver for an elderly lady that needs thickened. And they said, I'm having trouble with this. And I said, get yourself a frother. It'll mix in perfect.
Yes.
So if you're having trouble with your thickener.
Where did I see a bunch of those?
TJ Maxx.
Yes. That is where I was.
Yeah.
They have fancy ones and they have just plain ones.
And they're not super expensive either. If your heartburn is from dysmotility. So the dysmotility I find is typically caused from the heartburn. So it's this vicious cycle. So the goal is to address it ASAP so we can stop it from progressing. So if we're addressing the triggers and we can get that inflammation down, yes, this should still work. So the dysmotility is just that change in the muscular ability to push food down.
Yeah, so the muscle contractions, and sometimes that's because there's been so much damage to the mucous membranes that all of that contracting is not allowed because of the tightness of the mucous membranes that have been burned.
So addressing the heartburn from a holistic standpoint, figuring out those triggers, really, really helpful. Yeah. We have a number of clients with dysmotility, and the goal is to decrease what's causing the heartburn.
Yep.
100%. And we do that through food and identifying what those triggers are. Yeah.
That is true.
That's all I got.
Any other questions?
That's a great question, Megan. Thank you. Yeah. Enjoy your tea. Drink more tea, everybody. It's good for you. It's anti-inflammatory. It's helpful for your stomach. It sometimes feels really nice on your throat, depending on what you need, hot or cold.
Yes.
Yeah. Drink more tea. That's my tip of the day.
Drink more tea. Today, tomorrow, and next week.
Yeah. And if you, I lied. I'm not done. Nothing's changed. If you add a little bit of lemon juice to your tea and you're a low acid producer, that can help as well.
Cool.
Because that adds a little bit of acid. Now, if you're a high acid producer, that will not help.
So I heard you telling someone this the other day. How do you know if you're a high acid or a low acid?
I will have to get the exact timing for it, but you take baking soda and water, just like I said, for those people that are high acid producers, you do that. You mix your baking soda up, you drink it. For those of you that are high acid producers, you're going to have a burp pretty quick. For those of you that are low acid producers, you may not burp at all because there's nothing to neutralize. So you know when you were a kid and you did the baking soda volcano experiment, same thing is happening in here when you drink that baking soda water.
Sure.
So if you have a burp and it happens pretty quick, odds are you're a high acid producer.
Okay.
If you're a mid-acid producer, I would say it happens somewhere between like 2 and 4 minutes, 2 to 5 minutes that you have burp. But don't quote me on that. I'll have to get the information. But that's one way to tell. I'm a high acid producer.
Okay. So you burp pretty quick.
Which explains why the apple cider vinegar didn't ever work for me.
Gotcha.
Because I already had enough.
You had enough.
Yeah. I usually burp if I drink baking soda. I burp within like 15 to 20 seconds.
Okay.
Yeah.
Yep, that makes sense.
Yeah. So I wanted the apple cider vinegar to work really bad and it just didn't. And that's because I already have enough. Eat more protein. So I eat enough protein and I don't get heartburn like I used to. That's the other piece.
Yep.
I aim for 20 to 30 grams of protein per meal and I feel better.
Okay. Good suggestion.
And less fat.
That helps too.
Yeah. So, all right.
Cheers to everyone.
Cheers,
Have a great
everybody.
week. We'll see you guys next week.
Yeah. Cheers to you.
And hopefully you'll have some sleep by then.
Well, I didn't miss my flight, so I'm not getting on an airplane for at least another month and a half.
Month and a half.
Yeah.
Okay.
The next conference is not for a while, so I won't have the opportunity, and I'm never flying American Airlines again if I can avoid it. Let's put it that way.
All right. I don't think we're flying American in February.
We are not. Yeah.
So there you go.
All right, everybody. We're here for you if you need us. Send us questions. We're happy to answer.
Yeah.
Have a great day. And a Happy New Year.
Oh, yeah. It
First-
was.
Yeah.
This is our first of the new year.
Yep,
Have
it
we
is.
talked a little bit about our membership?
We haven't.
Yeah.
Do you want to
Let's
talk a little
just
bit?
say it quick. Our membership is open.
Yep.
There is a link.
Yep. I will also post it and pin it at the top, or you can, either one.
We can pin it to the top. You can go to our website at dysphagiaduo.com. It's also available there. That might be the easiest way to find it, actually. So you would just go in through the membership
and
tab at the top.
It's a monthly membership. We're going to do Q&As every month. We have our first couple of guests lined up. So I think we have our first guest in February. Steph and I will be doing a masterclass similar to kind of the one we did today.
A little more in depth, maybe a little more details.
On just dysphagia to start, because that's what we're all about. And sometimes people just need information. So
And it would be live, so live over Zoom, so you would have the opportunity to ask questions, face-to-face questions.
Yes. And then we're going to do a sort of a masterclass on a real-life person with dysphagia and what she went through and how she's doing now and how she got to the point where she's at now. So we're really excited to talk about her story as well.
We are.
So
it's a good one.
we're going to also have a private community for everyone in the membership. And we're also going to have recipes that are moving into the membership vaults. We've got some other exercises in there, and then just some other resources. So our goal is to just get you as many resources as possible.
Yes.
Join the membership.
See you there.
Yeah. Have a great day, everybody. Happy New Year.